We have RFK Jr., who's now at the head of Health and Human Services, which I think is probably my White Claw could probably do a better job at running the department and is probably has more
Is your
education.
White Claw willing and able? Because if so, I'll do it.
Telling you.
Yeah.
Yeah, no, it probably has the same amount of experience as he does. Hello, team, and welcome to Beerocracy. I'm your host, Emily Gross. I'm very excited today because I have Dr. Craig Spencer with me, who is public health extraordinaire at Brown. Craig, thanks so much for being here.
Absolutely. Thanks for your compelling pitch, which was, hey, talk about public health things and drink a beer. And I was like, well, I'm going to do both of those things tonight anyway. So I might as well.
No, that's like my favorite activity when I'm drunk. So I'm like, this is why I made the podcast.
To drink another beer or to talk about a podcast? Yeah, cool. Good. Then we'll work well together.
Perfect. So we're going to be talking all about health and human services, all these cuts, USAID, everything that's been slashed and the long-term effects that's going to have. So Craig, before we officially dive in, what are we drinking?
I am drinking a Fat Orange Cat, which is from North Haven, Connecticut. So it's pretty close to where I'm at in Rhode Island. I like it because it's one, good, and it's two, cheap. So I think it's like $7.89 for a 4-pack, which I know to your Lower East Side brain is like unfathomable and impossible.
Like, you mean like $12? Like, what do you mean?
Like $12 for a single? No. And it's called Stay at Home Dad with No Kids. And I am neither of those things. So I think it's appropriate.
Perfect. And I'm having a White Claw. Please don't be mad at me. It is in my fridge. And so I'm drinking it.
You know, I've never White Claw. I know, like 99.
You've never had a White Claw? Good for you.
Know, it's weird.
Good for you. That's something to be proud of. I'm ashamed and I'm going to enjoy it.
Okay,
but cheers.
Cheers to us. Let's get into happy talk.
Yeah, woohoo. So why don't you tell us why we should trust what you have to say?
Man, that is such an important question right now. I presume that after I tell you all the things about myself, there'll be people that'd be like, that's exactly why I don't trust you. Man, this is like such a moment for public health. Let me tell you who I am, and then you can determine whether or not you want to trust me. So I'm an emergency doctor. I've been working in emergency medicine since 2008. I did my residency out in Queens, which is why I moved to New York. I loved it. It was so cool. But I knew that I wanted to do something else. I wanted to work internationally. And so I did a fellowship in global health at Columbia, which is what brought me to Manhattan and Harlem, where I was at for over a decade. And I spent like 6 months of every year working internationally, basically volunteering in Southeast Asia, Sub-Saharan Africa, in any type of medical humanitarian crisis. So think about an Ebola outbreak in 2014. I was there in 2015. Think about working on board a ship providing medical care to migrants in the Mediterranean. I did that in 2017, 2018, responded to civil conflicts and civil wars, did like trauma medicine. And it just helped do kind of healthcare leadership, primarily in like humanitarian response. So think about like Doctors Without Borders. And this whole time I've been working clinically in the US. I have been also doing a lot of public health. So writing, speaking, doing a lot of advocacy, doing research on particularly the historical determinants of public health, meaning like the moment that we're in now, how can we explain public health today by what came before it, and how does that help us build better and more thoughtful policy going forward? So I guess there's like a couple buckets of my life. I still practice emergency medicine. I've been really into public health, particularly public health policy, and I've worked a lot internationally responding to medical and public health threats. So the last few months have been really difficult for me, not just because my life has been built around all of these things, but like, so is my friend group. These are all my friends, like cuts at HHS, CDC, NIH, rough. Cuts at USAID, like dozens and dozens of my friends like were laid off, in the span of just a few days. So this has been like my orbit, my orbits, this kind of public health space domestically and internationally. And so those are the things I know. Whether you can trust me, man, like the last 5 years have been tough at public health, right? There are going to be people that are, they're going to be asked like, did you tell people to wear a mask in the last 5 years? I don't trust you. You're going to tell people they got a COVID vaccine in the last 5 years? I don't trust you. And I know that because when I put stuff on social media, that's what people say. And so I get it. I'm out here. I want people to trust me. That's why I do stuff like this. So I don't know. Let's dive into it and see if I can convince a
Let's
few.
dive into it. I mean, I
Yeah.
think you're probably the best person to have on this with the most experience because my medicine experience is watching Grey's Anatomy and being on WebMD. So really happy to have you.
You got to update this. The Pit now and Chat
Oh,
GPT.
I'm obsessed with the pit. We can talk about that later. I sit there sobbing, crying, anxiety, but I'm like, I can't stop. Anyways,
Yeah. We can get into it. Yeah, for
we can
sure.
get into it. But let's dive in. So there was all these 10,000 people were just cut from HHS on top of another 10,000 that had been laid off or deferred resignation, stuff like that. So cutting the force by 20,000 people. When prepping for this, realized it was like, oh shit. I don't think a lot of people realize like, oh, under the HHS is the FDA, the CDC,
NIH.
NIH. All of the massive health organizations that keep us going are all being cut.
Yeah. $1.8 trillion in the United States is all run by HHS. It's like a massive part of the US economy because healthcare is such a big part of the economy and it's all basically run by or under HHS. It's massive. Yeah.
What does this mean? What is this going to do? What are the effects?
Shit, let's go back to October, November of last year. All right. And let me walk you through something so you get an idea of what normal looks like, right? Because we can't talk about this moment and how kind of weird and unprecedented it is without knowing what should normally happen. So think about what would happen to an international health crisis in like September, October of last year. There was an outbreak of what's called Marburg virus disease. It's just like Ebola. What you know about Ebola is nearly the exact same. And there was an outbreak of this in Rwanda, small country in East Africa. 30 years ago, Rwanda was riled by genocide. Like the country was just torn apart and devastated. And in the last 3 decades, particularly with a lot of US and international assistance, Rwanda has gone from genocide to burgeoning middle income country with a really strong health sector with like guaranteed insurance, health insurance, and like it's hosting conventions and it like makes vaccines. Like it's a standout on the international stage for how far it's come and what it's capable to do, especially in like the health, medical, and public health space. So there was an outbreak of this Marburg virus disease, super scary, like 80% of people that get it die. And one of my friends was working in the hospital and called me and said, Craig, there's an outbreak of this viral hemorrhagic fever, Marburg here. I'm really scared. What are we going to do? And within a couple hours, I got on the phone with a colleague who happened to be the global health lead at the White House. And she got in touch with this institute down in New York called the Sabin Vaccine Institute. And they basically create investigational therapies for scary diseases like Marburg and Ebola. Within a week, through international assistance, US support, the White House, global health getting involved, there were vaccines in the country of Rwanda being given to people like my friends to protect healthcare workers from dying from Marburg. There were investigational treatments that were being given to her colleagues to prevent them from dying. And the result was Rwanda had built a strong health system with US support, was able to respond to this outbreak of a disease, scary disease, with the lowest mortality ever recorded for Marburg. Like unbelievable. The outbreak was over. You never heard about it. It was never on the front page of the New York Times because it was handled well in the country, but it was handled with a lot of US support. So that is our baseline. That is what we want. What happened in January? Well, when the Trump administration came in, the first thing they did, like literally day one, is they moved to withdraw the United States from the World Health Organization. Now, this was something that they did the last time they were in office, but because of like the timing thing, it didn't actually take effect because there was a delay between your intent and when you can actually get out. So that didn't happen. But this will almost undoubtedly happen this time around. The other thing that the administration did on day one was put in place a 90-day freeze on all foreign aid, foreign assistance. Includes everything, particularly here, USAID, which a lot of people have undoubtedly heard about. One of the big things that USAID was doing and has been doing for over 22 years was this thing called PEPFAR, the President's Emergency Plan for AIDS Relief. What this was an initiative not by some crazy lefty globalist liberal. This was George W. Bush, who was pushed on by the evangelical community to say, holy shit, we need to do something about this AIDS pandemic and people dying, particularly in Africa. So over 20 years ago, well before White Claw existed, they got together and said, let us find a way to stop the HIV pandemic. Unbelievable. And to date, 26 million people's lives have been saved by it, by the goodness of US support. 20 million people were on medication, including 500,000 kids, the day that Trump came back into office, and all of that stopped. There was some like, hey, maybe we can find a different way to do this or keep doing it. You should get, but like none of that happened. I talked to friends around the world that were leading this program. It didn't happen. So what that meant was, early January, people would go into a clinic somewhere in the world and they would get their HIV medication and they'd see like a sign that said USAID and the tagline was from the American people. And then the end of January, if they went back to get their medication, they would basically be told by someone, sorry, there are medications behind me on the shelf. I know, but I'm not allowed to give them to you. The US government says that we're not doing that anymore.
That's insane.
It's pure insanity. Look, and what I hear from people is like, yeah, why is the US government got to do this? Why are my tax dollars need to go do this? One, if you don't care about the ethical and moral implications of this, like, whatever, fine. I'm not going to convince people on that. But two, like, national security. Stopping HIV, people don't remember 20 years ago, man, HIV was super, super scary, right? Now it's a chronic disease for people. We all know people with HIV that like live normal lives on medication if they're lucky enough to access it. And so it has helped bring the pandemic, the HIV pandemic, under control. That means less risk for every single person. It also means less likelihood of development of new variants and resistance to the medications that we have. But then lastly, I think we can have a discussion about what other countries can and should be doing to support their own. That's a great conversation, but we do not need to do that. We like literally overnight. That is no hyperbole, right? And so have a conversation, say in a month, in 2 months, in 6 months, in 9 months, whatever. In 2 years, we're going to transition some. That's not what happened. It was literally an overnight, like, now you got it, now you don't. And so what happens when people go back to the clinic and see that American flag and that tagline that says from the American people? Well, now they think, man, what a bunch of traitors. Like, this is crazy. And so you have this, like, we started the story with like, what normally happens? A Marburg outbreak in Rwanda that is well managed. And what's going to happen now? If there's an outbreak of something anywhere in the world today, countries are going to have a hard time detecting it because we got rid of a lot of the capacity that the US used to support in doing that. Outbreak of disease Q somewhere in, Central Africa, countries aren't going to be able to detect it because we're not providing that support. They're not going to have any incentives to report it because previously the US would have provided assistance like CDC support or USAID folks to come on the ground and help detect and like manage that outbreak. They're not doing it now. So all you're going to get if you're a country and you report an outbreak is you're going to get some stigmatizing travel ban. They're going to say, oh, we don't want those people. So there's no incentive for countries to report it. And then what's going to happen, these outbreaks are going to get bigger. They're going to spread more quickly. They're going to travel internationally. And they're going to show up in a country right now where we're absolutely tearing apart our public health infrastructure and making it harder for us to detect diseases here at home. So I don't know. That's like a topical.
Yeah, what could go wrong?
Yeah, yeah. I mean, I can tell you exactly what. Let me need another beer.
Yeah.
We know what's going to go wrong, right? Like I can
Right.
with 100% certainty. Like people are like, oh, well, we haven't had Ebola here. No, we haven't had these scary diseases here, and it's just like, cool. One, yes, we have. Two, we've managed them well because we have capacity or have had capacity. But three, there's a reason that those things haven't happened because
Right.
we've done a really good job of managing them at their source and then keeping them out of here. And that's not happening anymore.
Yeah.
Does that make
No,
sense?
it's insane. Oh, it makes a lot of sense. And
Okay, cool.
also like what you previously mentioned as well, just from like the moral ethical standpoint and protecting on a health basis, like Americans, USAID and America being in a lot of these countries, helping with this aid and stuff like that, and making sure countries are relatively stable,
Yeah.
is generally a good soft power move for foreign policy by the US. Not saying I necessarily agree with it, but generally,
Totally.
it's a good soft power move.
I think that's a good point. Like you can agree or disagree about whether we should be doing it, but you cannot disagree with the impact that it has. Like the soft power has been beneficial. We're going to see that now as we unroll it and we get rid of it. But look, there have been studies that have shown by helping stop the pandemic, HIV pandemic, by the US doing things like PEPFAR, we have made countries more stable, right? So imagine if you are in a place, HIV is going around crazy, your country, your government isn't doing anything about it. You're going to get angry, you're going to riot, you're going to rebel, like all these things are happening. Those things aren't happening. People there's more stability in many of these countries because of these aid programs. Now, you might be like, okay, well, what do I care about stability in a place like countries I don't even know about? And the reality is that keeping those places stable is how you prevent people from being open to recruitment by terrorist groups. That is how we prevent diseases from getting worse and from spreading. That is how we make sure that there are stable markets for people to be able to go to work and make things that we can buy and can buy stuff from the US. So you cannot care about this thing from an ethical and moral perspective. I do, and I think that's important. I will tell you, Emily, a lot of people who couldn't give a shit about the ethical and moral argument about these things or anything else that we do. So I'm trying to talk to those things. I'm also trying to talk around them and say, even if you don't give a damn how many kids die in sub-Saharan Africa or Southeast Asia because we're taking away HIV medication from them, you should care for a whole host of other reasons, and not just the fact that we look like idiots and that we've got all these commitments and we've promised to pay for things and now we're not doing that, which I guess is part of Trump's, history.
Yeah,
So not
and
surprising.
recent lawsuits,
But
so many lawsuits, but yeah.
Yeah. And so it's just, if you're thinking straight up realpolitik, I just want to be, the most politically savvy, then keeping these programs that were 1% of our budget. Think about this. Every single dollar in taxes that you pay, 1 penny went to stuff like this. Every household spent the equivalent of $9 a year, basically, to have foreign aid, to make sure kids not only had HIV treatment, but to make sure that Ebola was stopped and that there was airport security and screening in places like Uganda or other places where there are Ebola outbreaks. Someone will say to you, well, why don't they just do that? Why doesn't Uganda set up screening at an airport to make sure Ebola doesn't leave the country? They don't give a shit if Ebola leaves the country, right? Why are they going to spend money to stop something from leaving the country, right? And so the U.S. has had a really big role in being no, we have an incentive here. Let's put some money and some expertise and some people in this place to help support you so that Ebola cases don't get on a plane. We're not doing that anymore. We don't do that anymore. So what's going to happen? Those cases are going to get on a damn plane.
And everyone who's the COVID pandemic wasn't bad. It was an overreach of power. I can't believe they did this. People have severe long-term effects. Once again, 1 million Americans died. That's an insane amount. And for people to be you made me wear a mask and I could have gotten CO2 poisoning. 1, no. 2, 1 million Americans died. Yeah. Get over yourselves. Respectfully.
Yeah. I mean, this is tough because obviously, I worked in March of 2020. I was working uptown in Manhattan. I walked into the apocalypse every day. There were so many folks that showed up every single day, despite the fact that they, especially in March and April 20, we had no clue, man. I saw 40-year-olds dead in a chair. It was a straight up apocalypse. And if people are going to sit back and tell you, look back through the telescope with tunnel vision of the last 5 years and be we overreacted in March 2020. We overreacted in April. Y'all are crazy. Let me tell you, it was a straight up apocalypse every single time that I went to work. The apocalypse. I saw more people die on a daily basis at that time than I did in an Ebola treatment center in the middle of the Ebola outbreak in Guinea where I was working. It was just unbelievable. Now, were there mistakes in the next couple of years? Totally. Are we compressing 5 years into 5 seconds in our mind and be oh, maybe it wasn't all that bad? Yeah, but you're right. It's even worse than Emily. It's 1.2 million people. And then if you look at excess mortality, the number of people that died over the last over those years that should not have died, it's 1.7 million. Now, there were other things that happened. Schools, and they go on this whole debate. I had to wear a mask and I couldn't, whole host of things. I get it. The reality is that the baseline was, it was not going to be okay. No matter what we did. There's no perfect solution. There's no we could have done this all over again. And if we did nothing, it would have been better. Or if we did, we could have done certain things and it would have been better. But this idea that doing nothing would have been better, or just going about our lives and pretending COVID didn't exist was somehow going to miraculously save more people, straight up bananas. So I feel you, but I also I sympathize with a lot of people who did lose a lot, who had really tough experiences during that time. I sympathize with people who like lost their family members and couldn't see them in their last moments. Like how many people's hands did I hold in a hospital where their family wasn't able to come in? And like, yeah, looking back, could we have or should we have changed some of those things? Sure. Would it have been like really hard to get family members into a hospital when there's like people dying all around us? We didn't have enough healthcare staff and like, yeah, but like we can sit back and we can like reflect on these moments and be like, what could we have done better? But we can also avoid the, I don't know, this tendency just to go back with, yeah, a whitewash view, this revisionism of like, maybe it wasn't so bad, relitigating 2020 and really 2021 through the eyes of 2025 when we have vaccines and we have safety and we know what we can do as medical providers to save people. Like, they're just different times and different places, but I completely feel you.
Yeah, America famously loves revisionist history.
Really good at it.
Very good at it. But so what's kind of mind-blowing to me, I mean, there's a couple big things happening, right? We kind of did a little bit of like an international peek of what this means, right? On a foreign issue. On a domestic issue, I mean, we got fucking measles back. We have bird flu, and we're also getting rid of FDA people. Like, there's metal in your snack. Sorry, you're not going to find out about it. Like,
yeah, I know you're kind of joking, but not really. Like,
but I'm not.
There was like lead. I have kids, and they used to like you see all these little kids going on with like little applesauce packets. There was lead in a bunch of them. We figured it out, but like
because of cinnamon from some plant somewhere, right? But who figured that out?
Yeah, exactly, right. And so you get rid of these things. I don't think. Okay, let's put this all in context because you're right. There was this, already thousands and thousands of people that got let go at many of these agencies. The kind of probationary employees, people that were hired less than a year ago, this administration was allowed to just basically fire them as probationary employees and be like, thanks for your service, goodbye. So you've already got rid of thousands of those people across many agencies, including CDC. What happened most recently is those cuts across HHS targeted the kind of alphabet soup of public health agencies, CDC, NIH, and many others, FDA. 3,500 people got let go at the FDA. What do those folks do? They do everything. They do like tobacco control. They do oversight of plants where things like cinnamon and like, food and drugs that are used in this country are made or manufactured or put into pharmaceuticals. Like we actively have people from the US FDA that go to these plants where our drugs are made. And remind you, most of our drugs are not made here in the United States. They are made in other places, in China, in North Africa, in many other places. And so we have FDA folks that go to make sure that those facilities are up to snuff. And if they're not, then they close them. We're not going to have as many people doing that anymore. People at the FDA will make sure that the food and the medications that we use are safe or effective, like devices that get implanted into people's bodies. The FDA is the one that like makes sure that that stuff is all okay. Like you have fewer people doing that. At CDC, there was massive cuts to things like EPL, which is basically the public laboratory network around the country, the one that does like foodborne and waterborne diseases. You go into, I don't know, Market Basket or Kroger, wherever the hell you're from, and you're like, I want some broccoli. And you go over and you grab some broccoli. And never do you think, wow, I bet you there's cryptosporidia all over this broccoli, right? You don't worry about that. Yay, that's awesome. Like that is pretty novel in human history, but it's because of crap like the CDC who has people that go out and like make sure that that stuff is safe. Like there's not just massive amounts of bacteria and viruses on the food that's being sold or out in the environment or in the wastewater or in our own drinking water. Like that's what they do. And you can argue, and I actually agree with some of this argument, that there were people at these agencies that could go. There was, quote unquote, I'm doing air quotes. There was bloat and there was fat, and that some people could be let go, and that it wouldn't, change overall the efficiency of the organization. I think that's probably true. That's probably true for every company or organization or department. Here's the difference. there's a difference between saying we're going to cut 10% of our workforce and be thoughtful about it and make sure that we're more lean and efficient. There's a difference between that and being like, I'm going to cut 10% and I'm just going to do it indiscriminately and maybe I'll cut off my head. And it was the latter, right? It was no thoughtful, at least as far as I can see, no one has shown me their work. It was no thoughtful consideration about the people that were being let go. It was clearly meant to be malevolent and nefarious and just straight up evil. And if you try to tell me that it's not, I'm going to remind you that it was done on April Fool's Day for a fucking reason. Um, right? Like we could have waited a day, right? Like, so look, what is the impact ultimately going to be of getting rid of people that do occupational safety and health at the NIH? What is the impact going to be of getting rid of like 5 of the most experienced people that have run NIH programs? What is the impact going to be of getting rid of thousands of people at FDA? What is the impact going to be of getting rid of people at the CDC that do injury work and make sure that workers are safe on the job? Like all of this stuff that just spans so many things that we can hardly wrap our mind around it. What is the impact going to be? It's going to be huge, and we're going to regret it. Yeah, like that is a TLDR. Do you need to know every single position? That was like, oh no, if you want to, there's a Reddit thread that talks about people who have worked at an agency for 27 years. They're veterans. They've given everything to public health. They could have worked in other places and made a lot more money, and they decided not to do that. And then they were just canned overnight, not with like a nice email or whatever. It was basically like, go up and check your badge and see if it works. It's nefarious. It's
humiliating.
Mean, it's humiliating. And we're going to pay.
Yeah, it's really upsetting. We have RFK Jr., who's now at the head of Health and Human Services, which I think is probably, my White Claw could probably do a better job at running the department and probably has more education.
Is your White Claw willing and able? Because if so, I'll do it.
Telling you. Yeah, no, it probably has the same amount of experience as he does. And he's an anti-vax pusher. And, we have a measles outbreak, which is unfortunately becoming more common, which was a disease that was
eliminated.
Yeah, eradicated, right? And it's back. And I was just reading already, I mean, he's been pushing like vitamin A, which, as you know, and as I'm just parroting off an article I read, when used in a medical setting by a doctor in a specific situation can be helpful. However, him just pushing out this information has already led to multiple children having vitamin A poisoning and measles because of this disinformation and misinformation.
Yeah.
I guess my question would kind of be, like, this is happening because of a lot of people are shying away from vaccines, and there's a lot of concerns about vaccines. What do you have to say to those people?
It's a good question. So let me start with this. 92% of all kindergartners were vaccinated last year. So is it 95 that we want? No. 92. Tell me anything in this country that 92% of Americans can agree on. Tell me anything that 92% of Americans will do together. Not a damn thing. So we talk a lot about anti-vaccination, and unfortunately, the people running, the $1.8 trillion health organization in this country happen to be rabid vaccine cynics, not even skeptics, right? They're vaccine cynics. No matter what RFK Jr. will try to tell you on a Sean Hannity interview as he's eating beef tallow fries at the Steak and Shake. I watched it. If you haven't watched it, y'all should, from a couple weeks ago. Like, he'll tell you, like, oh, yeah, you should get vaccinated, but also, yeah, cod liver oil. Like, we know what he has said over the past couple of years. He said vaccines cause autism. He said the COVID-19 vaccine is like the deadliest vaccine that's ever been made. He said that there's no vaccine that is safe. Like, he has said these things. They're on the record. He has talked about the fact that, like, Blacks and Ashkenazi Jews have, like, different bodies and, like, different, immune systems. Like, he just holds, and I say this knowing full well what I'm saying, like, he holds, like, race scientist eugenical views about people and about health, and this idea that we straight up need to go back to 100 years ago when everyone just ate well, and that's what kept us safe, and that's what made us healthy. Let me tell you about 100 years ago. Your life expectancy was probably about like 40. 50% of kids in New York City in the early 1900s died before their 5th birthday. Do you know, people have all like read the book, or maybe we're supposed to read the book, The Jungle by Upton Sinclair at school at some point. Um, if you don't recall the specifics, it's about working in a meat plant in Chicago where there's like rats and fingers in it. That is what directly led to the FDA being created, right? And so there was no magical time when we were all healthier, when we lived off the land. Like, our food was contaminated. We got an FDA to prevent that from happening. Our medicines were straight up snake oil, like actual snake oil. We got an FDA to prevent people from selling snake oil. And it took a really freaking long time, like into the 50s and 60s, for the FDA to have the strengths that we needed it to have to protect us when we're tearing those away. And so, what do I have to say to people that are like, I don't trust vaccines? Over 90% of parents do for their kids. Vaccines have been probably the most incredible public health intervention of all time. I assure you with 1,000% certainty that if we went back to like 1890 and we're like, hey, mom, 50% of your kids are going to die in the next couple of years, but we can stop that with a couple of vaccines. And we're like, sign me up. Let's go. Also, can you do something about this swill milk that's killing my kids? Like, I'd love if we could do that. And also, that medicine that I keep giving to my kids that, like, I guess supposed to make them sleep, but secretly has morphine and alcohol in it and they keep dying. Like, can you do something about that as well? Like, I get it. I get the last 5 years, people have lost trust in public health. Maybe they have lost trust in vaccines and they don't know about COVID. I get it. But we are going to find out the easy way or the hard way what impact vaccines can have. We are having measles outbreaks. We have 500 cases of measles in this country, a vaccine preventable illness. We have a kid who died for the first time in decades of measles. And you're right. Like, we're hearing about this and people saying, RFK Jr. saying vitamin A. Now, vitamin A, let me just be very clear for people right here. It is not a prophylactic. It is not a preventative, right? The best thing to prevent measles, to die from measles, getting measles, is the measles vaccine. If I was working in a clinic taking care of measles patients in sub-Saharan Africa, vitamin A, 100% for sure. If I'm working here in this country and I have someone who gets measles, do I give them vitamin A? I do. The likelihood that it's going to dramatically impact their care here is much less significant than for a malnourished population in which this, the science shows that it can save lives, and vitamin A can dramatically save lives. Do we give it here? Yes. Do we recommend it here? Yes. But it is not the treatment that we need. What we need is preventing people from getting sick in the first place. If people get exposed to measles, the things that we do for them is not give them vitamin A. We give them a measles vaccine. And so, again, I want people to everyone should be a vaccine skeptic. Everyone should ask questions. Everyone should know, I got my 4-year-old vaccinated with the MMRV vaccine just a couple weeks ago. Did I do my homework on it? Yep. Did I feel comfortable vaccinating my own kid with it? Yep. Do I do that so that I feel comfortable vaccinating other people's kids? For sure. There's a difference between a vaccine skeptic and a vaccine cynic, and RFK Jr. is the latter. And people, particularly kids, are going to pay the price for that for years to come.
Absolutely. And who's in charge of looking at all the data and making sure that vaccines are safe?
Well, we've done this. This is been very clear. We have so much work on measles vaccines and are they safe? Do they cause autism? We know the answer to these questions.
Yeah.
But what's going to happen now?
What departments help manage that?
Yeah. So this has been done under the CDC. This has been done under HHS. It's done under FDA. This has been done through the NIH. NIH creates these vaccines and public funding goes into them. And so we create them. The FDA makes sure that they're safe. And the CDC does studies on them and makes sure that there's vaccine reporting systems and actually has compensation programs for the very small number of people, but real people that have some injury from vaccines. And this whole thing has been built over decades of missteps and mistakes and things that have gone wrong in the past. And then we have corrected those errors so that now getting vaccines, getting medications, eating food, any of those things in this country is safer than it's ever been. But we peaked, right? I assure you that RFK Jr. hiring a vaccine cynic, an anti-vaxxer, to lead a new study on the link between vaccines and autism, it has been disproven over and over again. But let me tell you, I guarantee with 100% certainty, they're going to find something, right? They're going to find some numbers that they're going to say justify the potential plausibility that maybe they missed something previously before, even if there's nothing there, because there is nothing there, right? And so not everything needs to be obviously nefarious. What they need to do is just poke some holes, and that's going to open up more questions. That's going to open up more concern, and it's going to hurt. We have up until I think like the big next public health crisis, we're going to have such a hard time convincing the public that COVID is not public health and public health is not COVID. It is so much more. It is so much else. And until we're able to separate our feelings from the last 5 years about COVID from what public health has done and normally does behind the scenes and what we needed to do today and into the future, we're setting ourselves up for big trouble. And the people in charge of making these decisions are only making it worse.
Yeah. That's a great note to end on. And I think a further reminder for people, you can be upset at what happened. You can feel different types of feelings in certain types of way. But there is not one doubt in my mind that the public health system is designed to do good and is looking out for the best interest of everyone. Does it make mistakes? Absolutely. Totally.
Guess what? I'm a doctor. I've worked in the emergency room for 17 years. Have I made mistakes? For sure.
Absolutely.
But the world will make mistakes. Like mistakes get made.
Totally.
Yep.
But you have the best interest at heart and you want everyone to be healthy and safe and good.
Totally.
And that's what the public health system is doing. And getting rid of it is just going to hurt everyone.
Yeah.
So, Craig, any last thoughts on this super fun episode?
Yeah, man. Get you down, or I gotta be.
I know this is why we drink.
This is why we drink. This is why I drink. Look, let me just say this. I spent like a month in the dumps, really worried, and talked to a bunch of my friends that got fired from USAID and from all the other things, and like it sucked. It's going to be rough, that's for sure. But I'm talking to, on a daily basis, the people that are going to get us out of this. I'm talking to the brilliant people in public health, in healthcare, and in medicine that are going to be there when this whole thing has been torn to pieces. And they're going to be the ones putting it back together again. I trust these folks. They're freaking brilliant. Their heart is like so strong. They're so smart. They're so capable. And although a lot of us are beaten, I assure you that so many of these people are going to show up to do this work, to do this tough work of piecing this all back together again and making public health as strong as it had been and as strong as we need it to be. It's going to take a lot of time. It's going to take a lot of work. It's going to take a lot of work for us to reach out to folks and get people to trust us again. And I hope we can do that outside of some other catastrophic threat. It's going to take some work from all of us, but I know the people that are willing to do it. And I trust that they're going to pull it off. It might be some time, but stick with us.
I think that's a good note to end on. So, Craig, thank you for being here.
Emily, thanks for having me here. Let's do it again.
Cheers. I'm your host, Emily Gross. We'll be back next week with another episode of Bureaucracy.